The Cone Health Cancer Center is actually comprised of 6 campuses throughout 4 counties. We serve approximately 2.5 million people. We see 4,000 new analytic cases per year, and we have 100,000 visits that people actually come in for lab services, radiation oncology treatments, just seeing their physician and making sure everything's taken care of, survivorship programs, and there's just a multiple things, support services that we provide to all the patients that we serve in the communities. We've won awards from the Quality Oncology Practice Initiative, which is COPI for certification. We earned accreditations and commendations to the Commission on Cancer. We've earned some Silver Award Touchstone Program awards from the Carolinas Health System, and it's just something that we're excited about and we're proud. The most recent one that we're proud of is the 2016 Innovator Award from the ACCC. And what it is, we've done some amazing things. Dr. Manning, who you'll hear from in a little bit, we've done some amazing things with our radiation oncology program and our team, and some of the treatments that we've come up with, some of the care that we've designed is just something that I think will be nationally known and recognized as far as what we're doing. And we're very pleased and very proud to be on the cutting edge of care, and at the end of the day, it's all about patients.
Costs across all of healthcare are rising, and the driving factor for us to look at oncology costs in particular was that within the scope of our accountable care organization, which is an organization including our physicians, and local payers, we were concerned that decades of improvements in oncology could be undone if access to sophisticated therapies was restricted. Essentially, our concern was that in order to cut costs in oncology, if you restrict access to sophisticated procedures like stereotactic radiosurgery or sophisticated drugs like Herceptin, that the quality of care would be diminished while cutting costs. And it's a widely known fact that the patients that are in the top 5% of spenders spend more than 50% of healthcare dollars. So by focusing on a small segment of the population, you can reap tremendous savings without necessarily restricting access to quality care. So in 2014, we reviewed the records of 31,000 Medicare beneficiaries, and we found patients in that population with a cancer diagnosis. And we looked for the top 5% spenders or hotspotters, and we restricted the population to patients who had been in our cancer center for at least 3 active outpatient visits to restrict it to active oncology patients. And then we performed a detailed chart review. We studied the cancer diagnosis, the types of therapies they received, who their physicians were, to see if we could profile our hotspotters. And what we found was a variety of cancer diagnoses, a variety of treatments with no predominant oncology theme. The theme was these were patients with significant medical comorbidities. 30% had congestive heart failure, about 30% had coronary artery disease, about that percentage had end-stage renal disease. And when you looked at their care over the course of the year of the study, we found that our hotspotters were high utilizers of the emergency department and had several hospital admissions. Ideally, the results of our study can be applied to help develop innovative programs at cancer centers to close the gaps in care that lead to high costs and identify potential hotspotter patients up front so that they can be the recipients of advanced care management. They will have a hotline to call, they will have an acute care clinic to go to, they'll be preemptively managed for comorbidities to help control costs. And in doing so, oncology will have an opportunity to reduce the costs of healthcare in oncology without restricting access to advanced procedures.
We're extremely proud of the cutting-edge, innovative work of our clinical care team. As you have just seen, Cone Health Cancer Center is addressing important healthcare issues facing our communities and nation. We have developed a unique, innovative approach to solving real-life problems that are rapidly applied for the benefit of our patients. We look forward to continuing to develop creative solutions for the improvement of patient care.